Hello. So I decided to do my project on whether or not states are actually doing enough to stop the spread of COVID-19. So just to start off, what is COVID-19? COVID-19, or Coronavirus Disease 2019, is a respiratory virus that originated in Wuhan, China, and has since spread globally and led to the pandemic that we're currently experiencing. The first case was actually confirmed in the U.S. in January 2020, and states have been implementing several measures since we first started seeing coronavirus cases to help slow down the spread, such as placing restrictions on bars and restaurants, closing schools, placing restrictions on gatherings and how many people can be there, declaring a state of emergency for the state, and mandating the use of face coverings in public spaces. So some questions that I was trying to answer while working through these data sets, I wanted to find out if there was a relationship between the measures that states have taken and the number of COVID-19 cases that these states are actually seeing. And then, are states actually doing enough to help slow down the spread? And then leading into, are states reopening too soon? And are they able to do so safely, or are some of them trying to reopen too quickly? The data sets that I used were from the CDC, the current coronavirus data sets, as well as the New York Times, and then I wanted to use these alongside the policy data sets from the University of Washington that kind of lay out when states started implementing policies to try to slow down the spread of the coronavirus. So first off, I just wanted to start off with this map. It just lays out how many coronavirus cases that states are seeing. As we can see, states with the highest number of cases are in the dark blue, and then as we get lighter, we see lower numbers of cases. And then I also laid out this timeline of when states started implementing policies to try and slow down the spread, and we can go through and add or take away any states that we want so that we can easily see what the restrictions are in the timeline. So I kind of wanted to start off with Kentucky and the surrounding states, because we see that Kentucky is kind of on the lower end of case count, but the surrounding states like Ohio, Indiana, Tennessee, Virginia are on the higher end, all above 100,000 cases. And then also there's West Virginia, who is surrounded by a lot of higher case counts, but they are on the very low end with only 7,875 total cases. So I just wanted to go through and see if some were implementing their policies earlier than others. So looking at Kentucky, we see that Kentucky declared a state of emergency on March 6th, which was pretty early on. And then almost immediately after, Kentucky started placing restrictions and closing things down. So we see that Kentucky issued schools to close on March 12th, and they started closing immediately after. And then we see Kentucky places restrictions on bars and restaurants, only carry-out delivery drive-through, so no inside seating at all. And then we can look at Ohio, who has a much higher case count than Kentucky. They declared a state of emergency just a few days after Kentucky, and then immediately started placing restrictions, well, at first recommendations and then restrictions on social gatherings and limiting how many people can be at those gatherings. So they are around the same time. Kentucky was actually a little bit after on placing restrictions on social gatherings, I believe, or at least the recommendations. So it's hard to tell if there's a relationship there, but if we look at Tennessee, we see that Tennessee was a little bit later in declaring a state of emergency, and then even later to close down schools, place restrictions on bars and restaurants, and close down other businesses. So we see that Tennessee has 122,000 total coronavirus cases, and so that may be the reason. It looks like there is a relationship there between how they implemented policies and their current case count. West Virginia, however, was probably around the same time as Tennessee on placing restrictions, a little bit later than Kentucky maybe, but they're still experiencing a very low case count. So it may be that these surrounding states have large cities that bring in a lot of tourists, but it looks like there may be a relationship between the time that states started implementing these policies and what their current case count is. Next, I wanted to look at this chart, and this just tells when states began their initial closures and restrictions. So we can see, if we look at Kentucky again, Kentucky started their bar restrictions March 16th and closed down a lot of other businesses March 17th, so everything closed in Kentucky around the same time. And then we can go back to Tennessee and see that theirs was a little bit later. So Tennessee closed everything down a little bit later, but started reopening earlier. So we can see that they started seeing cases in both states around the same time, but even in March, Kentucky had experienced 599 cases, while Tennessee was already over 2,000. And that's around the time that things started closing. But we see here with business health and safety measures, so that was for reopening and trying to allow businesses to reopen just with restrictions. And we see that Tennessee did that a lot earlier than Kentucky, which was in April, so we would be seeing the effects of that in May. Tennessee had over 12,000 cases at that point, while Kentucky only had around 5,000. And then, as Tennessee kept reopening, we see a huge spike in cases. We also see a spike in Kentucky, but not nearly as high. Kentucky was around 15,000, while Tennessee was around 60,000. In the month of August, we can't really tell yet, but at this rate, it seems that the case count will be around the same for the month of July, since we're already at 6,400, and in July we're at 15,000, and Tennessee is already almost at 19,000, while in July they were at 60,000. Next, I wanted to look at the new positive cases and deaths in the nation over the past few months. So we can see here the first reported case in the United States, and about a little over a month later, states began implementing their policies to slow the spread as other states started seeing cases rise. And then we see that even after states began implementing these policies, there was a huge spike in cases through June, July, and then around this time is when states started reopening, trying to allow businesses to be open with restrictions or just fully open, and that's when we see a huge spike, and we get to our highest number of cases in a day on July 16th with 75,711 cases. We can see after this, the cases are starting to decrease a little bit, but we're still much higher than we were when we started implementing these policies to slow the spread. We can see our highest reported deaths in a day was actually back in May, but we recently saw another spike in deaths at the end of June. So even at this point, when we were probably at half the amount of cases, we had the highest number of deaths. So based on this alone, I would try to answer the question about whether or not states are reopening too soon. I would say that they are trying to open too soon, and we're going to continue to see spikes in COVID as states allow businesses to reopen and lessen restrictions. We can also look over here. We can decide which states we want to look at. So Kentucky, we can see our current new COVID case count as opposed to July, which looks like it'll end up being the same where we are, but we can also see that we had a huge spike from June to July, almost 10,000 more in July than in June, which was around the time Kentucky started easing up on restrictions and allowing businesses to reopen. So I would say based on this that states are trying to reopen too quickly, and it's not really safe for them to do so. I think that we're going to be seeing more spikes in cases as restrictions lessen and states allow businesses to reopen. But I do think that we can see somewhat of a relationship between what states are doing and the number of cases that they're seeing. Like in Kentucky acted pretty early on, and the case count is much lower than the surrounding states. But whether or not it's enough, I'm not sure. I think that it's going to depend on how quickly Kentucky decides to reopen, because we are seeing spikes as we reopen. So at this time, I would go ahead and say that it's not safe to reopen right now, and we're going to continue to see these increases like we did in the month of July. And that is all. Thank you.